we can observe electrolyte mineral patterns by observing multiple weak muscles or recurrent weak muscles in a particular body quadrant. So all the body chemistry, or most of the body chemistry, can be reflected in this electron poison curve, which then is reflected into the body structure. This works for, this pattern of the electrolytes works for the cations, calcium, sodium, magnesium, and potassium. So we look at this electron poison curve. Now, you haven't heard the term electron poisoning unless you heard it from me. It is a term that was used by a group of biochemists, and they never got much traction with their concepts as far as calling it electron poison curve. But really what this is basic redox homeostasis, oxidation reduction homeostasis, keeping the oxidation reduction of the cell at its neutral point. You have to have buffering of hydrogen ions, right? The smallest positive particle. Well, you have sort of buffering of electrons, the smallest negative particle, but it's called poisoning, electron poisoning. But what it really is all about is redox homeostasis, oxidation reduction balance in the body. So we use the term electron poisoning in honor of Isaacs, who gave us the concepts, but it's really just redox homeostasis. So what we find out is that during depolarization, the positive ion calcium +2 and sodium +1 rush into the cell, right? And they cause a depolarization. On repolarization, magnesium and potassium, which were bumped out during depolarization, they go back and they go inside the cell. They were pushed out during depolarization, they go back. So we get depolarization, repolarization, and it's a movement of these cations primarily. So we know that you have depolarization, calcium, sodium rush in, potassium, magnesium rush out. On repolarization, calcium, potassium. On repolarization, calcium and sodium rush out, potassium, magnesium rush back in. So this is the normal patterns. Well, we know we have this minus 70 millivolt resting potential of a cell, and maybe minus 55 volts is the firing threshold. So we have a stimulus, and if enough of the calcium and sodium positive ions rush in to the into the cytoplasm, then we can get to this threshold of minus 55, we get more positive, and then we get the firing of the action potential. So this is basic firing chemistry. So what happens then is, on, I can't read my own slide. On depolarization, I'll read over here. On depolarization, calcium, sodium enter the cell, and potassium, magnesium leave the cell. So we drive the cell up to firing threshold, and then fires off, and even more takes place. So we see on depolarization then, we see these cations, sodium and calcium entering the cell, and potassium, magnesium leaving the cell. Then on repolarization, the calcium and sodium leave the cell, and the potassium, magnesium enter the cell. And so we have in repolarization here, we have the sodium and calcium leaving, and the potassium, magnesium re-entering the cell. And that's sort of really simple. That's like first semester physiology. So the calcium and sodium are related to the positions on the electron poison curve that you see, driving it down and to the left, and the potassium, magnesium drive it backward and to the right. So in a sense, the calcium, magnesium pull this curve forward and to the left, this being the left, and the calcium, magnesium pull it backward and to the right. And we can see this by looking at the electron poison curve superimposed on the body. And we see that if we do this, we look at the body on the curve, it has been talked about for eons, about people who talk about polarities and body energies, that the right front quadrant of the body is positive. The left front quadrant of the body is negative. The right posterior quadrant of the body is negative. The left posterior quadrant of the body is positive. Anybody talks about polarities talks about this. Well, what we see is, if we then superimpose the concept of these electrolytes on here, these cations, we see that the positive, the calcium is +2, it's more positive than the sodium. And so the calcium, being on the front part of the curve, goes in the front part of the body. Being more positive, it goes on the right. The sodium being positive, but being less positive than the calcium, is related to the left front of the curve. As the body is superimposed on depolarization, we calcium, magnesium come in, but the calcium relates to the right side on the front. The sodium relates to the left side because the calcium is more positive than the sodium is more negative than the calcium. So what it says is there's a relationship to muscle balance on the right anterior side of the body to calcium, a relationship on the left anterior side of the body to sodium. On the posterior side of the body, which relates to the repolarization, we have both potassium and magnesium, potassium is more negative than magnesium. Magnesium is more positive than potassium. If we look at the polarities, we put magnesium on the left posterior side of the body, potassium on the right posterior side of the body. And what we have now is a patient who has electrolyte imbalances, or at least cation imbalances, who may have muscle imbalances paralleling that. It's a very useful thing to know on certain kind of patients, especially ones that don't respond like they should. So what we have then is this relationship of these four cations, calcium, sodium in the front, potassium, magnesium in the back, and muscles balance related to these different cation minerals. So if you have a problem with recurrent muscle weakness and the body quadrant concept, right posterior muscles would be related to a need for more potassium if they're recurrently weak. Right anterior muscles would be related to a need for more calcium. Left posterior muscles would be related to a need for more magnesium. Left anterior muscles would be related to a need for more sodium. So you might have a patient who's constantly got problems on the left posterior side of the body, which is actually the most common one I see. They always have left posterior. It's always on the left posterior side. And they just have a deficiency of magnesium. And you give magnesium and it corrects that muscle imbalance, for example. So here we have again, calcium right front, sodium left front, potassium right rear, magnesium left rear. Multiple symptoms and or recurrent symptoms localizing to one particular quadrant are often due to a need for the cation related to that quadrant. For example, the left posterior quadrant problems would be related to a need for magnesium, and this, as I say, is the most common one that I see in my practice. So a patient could have a problem with decreased magnesium and the muscles on the left posterior quadrant would not work right. So a need for magnesium will often result in multiple weak muscles on the left posterior side of the body, such as the weakness of the left gluteus maximus, or low back pain, or the left levator scapula for neck pain, or so on. Left lower trap for thoracic pain, whatever. And so we see sometimes that because of this relationship of the depolarization, repolarization patterns, that the need for the potassium and magnesium is related to the repolarization, and a deficiency will cause a problem with that, and they may have all kinds of other problems as well, but they will have musculoskeletal problems on a particular quadrant of their body. Now, how often does this happen? Often enough to be aware of it.